Every year at the legislature, there is one issue that seems to generate a lot of heat and a lot of difference of opinion. This year it happens to be medical marijuana. We took a run at it in the last legislature, and they've come back full circle to try to pass bills. There are two of them working their way through. Today on the county seat, we're going to analyze both of them and look at them from a community impact level. So we wanted to start by talking about why medical marijuana in the first place. What are its components, what are the elements, and how has it medically improved people's lives? The marijuana plant is made up of over 100 individual cannabinoids. The primary ones are cannabidiols, CBD, and tetrahydrocannabiniols, or THC. This one is the one that has psychotropic qualities. According to the National Institute of Health, the human body also produces its own cannabinoid chemicals. Currently, there is medical interest in THC and CBD. THC is proven to increase appetite and reduce nausea. The FDA-approved THC-based medications are used for these purposes. THC may also decrease pain, inflammation, and muscle control problems, but it does have potentially harmful side effects. CBD is a cannabinoid that does not affect the mind or behavior, but preliminary research indicates that it may be useful in reducing pain and inflammation, controlling epileptic seizures, and possibly even treating mental illness and addictions. Other areas that show promise are in attacking certain cancers and tumors, including brain tumors, combating autoimmune diseases, multiple sclerosis, and Alzheimer's disease. So there is clinical evidence that there's medical value in marijuana or its extracts. So how do we implement it as a medicine to help people in Utah? That will be the topic of our discussion as we look at the two different bills when we come back.
There is a place where looking out means looking in, where an impression lasting only a few seconds will be imprinted on a life forever, where courage is forged and innocence rediscovered, where remembering is rewarding and forgetting unforgettable. There is a place where truth is felt and where seeing is believing. There is a place.
What do you picture when you hear Rich County, Utah? Bear Lake adventure, snowmobile action, pristine skiing, spectacular solitude. Well, if that isn't what first came to mind, then you just don't know Rich County. The Bear Lake Monster Polar Plunge, snowmobiling Monte Cristo, ice fishing Bear Lake, skiing the backcountry, fishing at the Cisco Disco. Come and find out what you never knew you were missing. Rich County, Utah. Have you ever wanted to recreate the world around you? Add some excitement, culture, adventure? Well, there's no need to remake the world when that perfect combination already exists. Just remember 4 words. Welcome to Weber County. In Ogden, you'll find everything you're looking for, from the top of Powder Mountain to the restaurants of our revitalized downtown. Ogden, Utah. Mountain to metro and everything in between. Visit Ogden.com.
There's a little place on a Utah map where I was raised, where my heart's at, where the sagebrush grows wild and high, and the stars come out at night. Oh, there ain't nothing like being raised in the basin with a Ute reservation, skiing starvation, that Duchesne County life.
149 million years in the making, dinosaurs once roamed this land. Now they're found at the Dinosaur National Monument. Let's take you beyond the bones. We call it Dinosaur Land. You'll find it offers adventures and sights not seen anywhere else in the world. Come to Dinosaur Land, Vernal, Utah. You'll want to stay forever. The dinosaurs did.
Welcome back to the county seat. Our topic today, medical marijuana. Joining us for our first conversation is sponsor of the bill for the whole marijuana plant to be prescribed in a medical condition, Senator Mark Madsen. Thank you for joining us, Senator. Appreciate it. First time you and I have had a chance to talk.
Thanks for having me. It is the first time. Pleasure to be here.
So let's talk about your bill. You are talking about, let's not be mistaken, because some people say, well, Senator Madsen's got a bill to legalize marijuana. You're not. You're actually medicinally defining marijuana. What are the main components of your bill?
Sure. Well, we do try to learn, first of all, from the other states that have done this, and almost half the states in the country have gone down this route. So we started and didn't want to reinvent the wheel, and we learned from their experience, and we picked conditions based on the science that exists for the treatment of people with cannabis. So we went, and again, to the other states, and they'd looked at the science as well, and we picked the 9 conditions that every other one of the states includes. And some have more, but we started conservatively. We only went with the 9 where the science is so conclusive. There's really not a lot of debate, I think, among most. In fact, I'm taken to walking around with a big binder with 400 studies off the National Institutes of Health website by condition in my bill, just to show people that there is substantial science that shows that helps people with those conditions. So we started there. And then again, I went and looked at other states. I talked to the regulators there. I talked to the physicians and the patients, and we tried to figure out how we get it to the people that need it. And we would project about 2% of the population based on what's happened in other states. We know the number of people with the conditions. We know generally the percentage of people that get cancer. We know the people that have epilepsy and MS and Crohn's, for example. We have data. We know that in other states there's a take-up rate that will be replicated here. About 50% of the people that have the conditions that would qualify choose to go that route. So we know about 2% of the people would have access. We want to make it available to them relatively easily, but in a very regulated way. Only the people that really need it and will benefit should get it.
So mechanically, how does this look? Your bill talks about basically prescribing the whole plant. Is it regulated through is that how you access it? You go to the pharmacist and say, I've got a prescription from my doctor for a dose of marijuana. Is that how that would work?
In a sense, yes. And we're wandering through a thicket here of conflicting law, sometimes of new law, non-existent law. And so some of the things you said, for example, we don't even use the term prescribe because we don't want to get our physicians in trouble. And so we use the term recommend. Again, looking at what other states have done and looking at the guidance we've received from the federal government. It's important to note that while it is still Schedule 1, that the political bodies at the national level on both sides, both the Republican Congress has said, we are not funding any enforcement against states that have medical cannabis programs for their patients. We're not going to use our resources to penalize those people, make them criminals, and drag them away. On the other hand, the Democrat administration has issued guidance, actually in memoranda, saying the states that do this, if they abide by these certain criteria, then the Department of Justice will not enforce against them. The Department of, or the DEA, Drug Enforcement Agency, will not enforce if they're abiding by this guidance from the federal government. So we've been careful to look at that guidance, again, look at the other states and make sure that we give as much safe harbor to the docs and the patients and everybody here as we do this.
So in going forward with this, I guess the question is, you know, a doctor recommends this and then where do they go to get it?
Sure. The patient and the physician meet in the office and they fill out an online application. First, the doctor has to go through state training and qualify even to be there. And we have limitations that no other states have on how the doctors can prescribe, which doctors can prescribe, how many patients they can prescribe to. We don't want to set up these pill mill type operations. So you go to your physician, you go online, you submit an application to the Department of Health that says, yes, you know, this is my patient, I've looked at the medical records, I'm a doctor, I've had the training, and then the Department of Health issues a card to the patient, and then the patient can go to a dispensary and can purchase where they sell that and only that. Cannabis and only cannabis and the implements that you use to take them as your doctor has told you. And so that's the process for the patient. Find a physician that has the training and is willing to recommend. Submit your application to the health department, you'll get your card, and then you go to the dispensary. Because of federal law, we have to do everything in the state. Nothing can cross state lines. So we have to grow it, process it, test it, and dispense it here. So we have licenses and government agencies that look over the licenses, issue the licenses to operate, inspect and regulate those entities, the grows, the processors, the testing labs, and the dispensaries.
So how do you keep the black market out of it? I mean, they're already growing.
Yeah.
They're already growing the crop here in Utah anyway, and it's just being raided. So are those people going to convert? Or?
It is a strange issue because yes, you know, in any high school you can within 10 minutes you can get some cannabis and get your off of the street, and we do have patients that are using it medicinally and have to seek it through that source, which is always a risk because you don't know what it's contaminated with, you don't know, and we don't want our sick people to be subjected to that. By the time it's grown and with all the inspections and the purity testing and the labeling and the measuring and everything, by the time it gets there, it's extremely expensive. So it's not going to be competing with the street drugs because it's going to be much more expensive. And we have very, very tight constraints, and we've, again, looked at other states. From the time the plant is a plant and sprouts a root ball, it's got a separate barcode that goes through it through the entire growth process, the harvesting, the drying, the processing, and you can trace it, and it all goes into a centralized government database. A milligram goes out the back door. The system picks it up. It's a problem they've largely solved in most of these states as far as it going out the back door.
How do you regulate dosing? I mean, I grow tomatoes in the backyard, and I get one that's just got a lot of, flavonoids in it, and then the next batch I grow doesn't. How do you approach with a whole plant regulating the dosing?
Yeah, it's a challenge, and it is different. I mean, it challenges our normal way of dealing with medicine and the way that we typically think about it, at least in certain aspects. If you're dealing with the raw leaf, with the flower, there is some difference. Now, in a sense, we want the difference, and the genetics are designed for differences because the difference in the genetics treats different conditions differently. So we've heard, CNN, the Charlotte's Web is especially good for these kids with epilepsy. So in a sense, the genetics that are bred differently for different conditions, that's an aspect that is very attractive. But you've got to know what you're getting. You need to know what strain, and you can test to know the ratio of the THC versus the CBD and other things. And there is data, and there will be more as we have more people and more broad studies that refines our understanding of what strains help people in what ways. The one thing that I would mention is that the therapeutic index is the measure of an effective dose versus a lethal dose. And for many things, aspirin, there's an effective dose, if you take 10 times as much, you can be into the lethal category. With cannabis, you're at like 20,000 times the effective dose is the lethal dose. That's why there's never been a recorded death from cannabis. I mean, you're more likely to be crushed by a bale of it than to be able to ingest enough to shut. It just doesn't work on the same parts of your body as opioids that kill so many people. The risk of overdose, or the risk of death on the back end is so de minimis that you can give the patient, and we do this with prescribed substances anyway, take some and then see in 20 minutes or 30 minutes, and if you take up to 3 more. So it's not unusual to give guidance and then let people, because my body takes all kinds of things differently than your body.
Sure.
And so we can treat it, and we can measure, especially once you process it. If you have the flower, there's some vicissitude, there's uncertainty. Once it's gone through the processing and it's in the form of an edible or some other ingestible, you have very precise measurement methods to where you can know exactly how many milligrams you're taking into your body.
So in the way that your bill is set up, the dosing of the 2 major components are as tightly controlled as the oil, basically. In other words, you got so much CBC, you got so much THC. Of course, the oil has
there's a limit to there's a limit to all the cannabinoids. There's a 10 milligram limit. We're talking about the processed. As it is right now, you can get to 60 grams of the flower or 10 grams of the processed cannabinoids, and the total is 10. And then your doctor would tell you what your ratio was and what genetics you would look at for what ratio. Is it a 1-to-1? Is it a 10-to-1? You would decide that with your physician. Then you go to the dispensary and you would find one of the strains that has that ratio that's best for your condition. Okay. Does that make sense?
It does. So, okay. But very quickly, why not just use the oil?
Well, the oil is one particular component, and there's very little research. The first symposium on CBD was in 2013. The material, the science we're relying on for our 9 conditions goes back for decades now. CBD is exciting, it's new, we might find new properties, but it is not something that we can rely on right now to treat these people. And the whole plant is the basis of 99% of the science that we have on cannabis at all.
Okay, excellent. Senator, thank you so much for taking the time to help us explain this. We will be right back. We are going to talk with Senator Vickers, who's the sponsor of the other bill, when we continue on the county seat.
Color. It's something that can be seen. But have you ever wanted to reach out and touch it? Experience it. In San Juan County, Utah, color comes to life like nowhere else on earth. Color can be more than an abstract. Color can be your gateway to a new world. Visit San Juan County and explore the past, present, and future in a way that you've only dreamed of. San Juan County. Color your experience.
Beautiful scene, isn't it? The great wide spaces of the wild, wild west. Hi, I'm Chad Booth, host of At Your Leisure. I'm asking you to support the Blue Ribbon Coalition. Their efforts responsibly preserve access to our public lands. If it were not for the Blue Ribbon Coalition and their efforts, you may not have access to millions of acres of land across the West. This is America's playground, and if we don't do anything, we are going to lose it. Join, participate, and donate.
Cannabis, base camp for your southern Utah adventures. You belong in Cannabis.
What would you do with an extra day in Utah Valley? Explore the Wasatch Mountains? Snap a family photo at Bridal Veil Falls. Cool off on Utah Lake or the Provo River. No matter what you're searching for, you can find it in Utah Valley. Bring everyone together.
In a place that is beyond words, there is nothing to be said, except take your time in Bryce Canyon country.
I'm a Utah's own dairy producer. I care about the health of my animals, and I care about the quality of food we produce.
Because when it comes to providing quality dairy products, I understand the importance of Utah grown and raised.
And the jobs we enjoy are vital, because Utah's Own supports our communities.
As a consumer, I look for Utah's Own products, because Utah's Own is good for me, and it's good for Utah.
Keeping it here at home, Utah's Own.
Welcome back to the county seat. We are talking about medical marijuana and the different forms that it's appeared in the Utah State Legislature this year. Joining us for this segment of the show is Senator Evan Vickers, Senate District 28, who has a great familiarity with the pharmacy industry and is the sponsor of the second bill, the cannabis oil bill. Senator, thank you for taking the time.
No, appreciate being here.
Why the necessity of this?
You know, as you look across the country, there really is some evidence that marijuana type products can help people. And I guess you could say it's kind of a wave going across the country. Look, there's 23 states that have done some form. Some have had some success. Most have entered into some pitfalls. Those that have done it through initiative and those types of legislative forums usually end up with a product that ended up causing some problems. We felt like that in our state, if we're going to do this, let's take a real look at it incrementally and see if we can't find a pattern that would allow us to treat patients in an appropriate manner and within a regulatory system that most mimics our current medical system. Our mantra has been from the very start of this, Representative Brad Daw and myself, who are sponsoring SB 89, have been that if it's a medicine, treat it like a medicine. So both from the medical side and the regulatory side. And so that's the pattern, that's the one thing that we've always gone back to. If there's ever questions about what we're doing or what's going on, we go back to that statement.
So let me ask you this question, because there are a lot of conversations that have come up over this. This is getting a lot of airtime on the street corner.
It is.
And so
a lot more than I'm comfortable with.
So one of the questions is why the oil instead of the whole plant? I know it has to do with the THC,
right.
But some people are claiming there's medical benefit in that as well.
So the marijuana plant has a lot of different cannabinoids in it. Okay, the two most prominent are THC, which is the item that causes the most psychotropic hallucinogenic effects, and CBD, or cannabidiol, which has deemed to have the more medicinal approach. It's non-hallucinogenic, non-psychoactive. So, you focus on those two. The whole plant, there's people that'll argue for the whole plant, say that there's an entourage effect with THC, CBD, and others. But there's really not a lot of good evidence for that. We know that it's a Class 1 narcotic, so that's deemed to have no medicinal value by the federal government, which limits educational research. It limits the ability to really know for sure what's going on. Now, there's a lot of research and a lot of studies out there, but for the most part, they're not empirical. They're all anecdotal. They don't have basis to them. There are some, and there are some that have been done by the federal government. In some cases, there's been a number of out of state out of the country. But when it comes back down to it, you have to kind of choose whether you do CBD, do you do THC, and how much effect does that THC have? We know the CBD does have some effect and some positive effects. And then the next question is, well, what does THC? Our focus has been on, let's stick with the medicinal portion of it, limit the amount of THC, and then move forward and see if we can find a path that will allow us to treat patients in a compassionate way, treat some qualifying illnesses, and then create a framework so that we can gather research at the same time and use that later on to be able to benefit other patients.
Okay, and that leads me to one of the other comments about your particular bill, is that its scope of who it applies to and who can be administered to is pretty narrow, and there are already people who are saying, yeah, well, we want that treatment, but we're outside that initial scope. Is this something that you would look at expanding into? Because there's some people who clearly think that the oil would help them, but they're not in your bill, so to speak.
We've established a framework so that can happen. Okay, and the way it works is that we're allowing the professionals, okay, the researchers and the physicians. I'm a pharmacist, true. Representative Daw is not. He works in a computer business. And so as legislators, we don't have the expertise to determine what should be covered and what shouldn't be covered. So we're asking the Controlled Substance Advisory Committee, who's composed of researchers, physicians, some law enforcement, to determine what are the appropriate steps. So we've started out with a list, and it is a good list. There's still, a significant number of patients. We're probably, going to target somewhere between 10 and 20,000 patients that will be able to be treated with this. So it's not like we're just treating a few hundred people. And then the framework is set up so that committee can review what's going on with these patients, review other studies that are out there, other things that have come forward, and then determine, year by year, even 6 months at a time, what are more appropriate things to add to it. So yes, there's a framework there, but the control is in place so that the safety features, the physician, the base, and it's also done in a medicinal dosage form. It's not done in a whole plant. The whole plant concept is very difficult, because how do you dose that? How do you dose an edible or a whole plant? Where if you can put it in a medicinal dosage form, and quite frankly, a lot of people overlook the fact that THC is available right now in a prescription medication. It's called Marinol. It comes in a 2.5, 5, and a 10 milligram tablet. So if a patient is working with a physician, and that physician, for one reason or another, decided that they thought they needed some additional THC along with what we're providing, they can just write for some Marinol.
And so basically, they're getting all the benefits of the plant through 2 pills, which leads me, you've set me up very nicely, Senator, which leads me to the next question and the comment that I hear on the street corner is, well, Senator Vickers' bill is just, it's going to put it into the pharmacy and it's going to make it a lot more expensive. So I'm just telling you what I hear on the street, Senator.
Well, I've heard some interesting things. First, we heard the people that are opposed to what we're doing and prefer the whole plant have said that we're not compassionate enough. Well, that's not the case. We're trying to do it in a manner that would be safe and effective. The thing I've heard is that I'm doing it for personal gain, because number one, I want it to be in the pharmacy. Well, you have to realize that is impossible. It's a Class 1 narcotic. Myself, my staff, or anybody associated with my staff will never have anything to do with it. And then the next thing I've even heard is that I'm worried that if the other bill, the whole plant, passes, that I'll lose money because nobody will be taking my drugs now because they'll all be on marijuana. And so I've heard all those arguments, but none of them are true.
Okay, so what happens if the legislature passes out both bills?
Then I think the governor's going to probably have to make a decision. That's probably unlikely in light of some of the things that are going on, and in light of the, if you were to poll the House, I think that you would find that that is very unlikely. You know, and so, but if it came to that, then the governor would have to step in. Either we'd have to come up with a compromise bill through a committee, or the governor would make a choice.
What happens if we don't pass either bill?
We would be where we are now, which you have to ask yourself, is that a bad thing? I don't know. I do think that it's time for Utah to step forward and do something. I just think it's appropriate to do it in an incremental manner. The other thing that could possibly be a negative to that is that in other states, initiatives have come forward, and there is an awful lot of money that follows the marijuana lobby across the country. For example, in Ohio last year, there was $70 million in advertising that was put forth when they had that initiative on the ballot in November. So initiative would be the next step for people that support whole plant. I think that it's time to pass something, and I think that we can get something passed, but I think that it's appropriate to do the incremental steps, set up the framework, allow the agencies to massage it, give them rulemaking authority, let the professionals decide, and then move forward as we see fit.
Would, in that rulemaking authority, or as they broaden the availability of the oil, are they going to have to come back to the legislature and say, we recommend this and we want this, the language of the bill broadened?
Some things we would. So let me clarify. So the rulemaking authority allows them to deal with the day-to-day operation of how it works and how it's distributed and how it's administered. What the qualifying illnesses are, percentages and all those, they definitely would have to come back to the legislature's recommendation. They would have to approve it.
And do you think that's going to be a hard thing? Because there are people that are looking, they're looking right away for, you know, there are a lot of people banking on this right now because there's there's a fair amount of suffering. I mean, a lot compared to the population is probably not a fair statement, but there are quite a few people who could benefit from this, and there, like I say, there's some that just sit just on the edge of it saying, well, why did these get defined and not my illness?
That's going to take some time. There's a good set of a group of qualifying illnesses. It'll give us time to treat those patients, find out how we're progressing, what kind of results we're getting, and then latitude to move forward later on.
So you see this as a research opportunity as well?
Yes, definitely. We've included that component in our bill.
Excellent. Well, thank you very much for your time. And that should give you both sides of the perspective here on cannabis in the state of Utah. We thank you for tuning into the county seat. These issues are important. They affect your daily life. We appreciate your support. You're being involved in the show. Remember, local government is where your life happens. Be involved and be part of the situation. We'll look for you next week on the county seat. If you'd like to share this video with your friends, well, you do that right here. If you would like to subscribe to our YouTube channel, you do that over here. If you'd like to interact with us on the county seat, that happens over here. If you want to watch the next episode of the county seat, you can catch it Saturday night at 11 or Sunday morning at 8:30 on ABC4 Good for Utah.